Kia ora, my name's Dr. Carl Horsley. I'm an intensive care specialist at Middlemore Hospital, and I have a Masters in Human Factors and System Safety from Lund University in Sweden. So very often human factors is kind of seen as the factors of humans. How do we communicate or how do we think about things? But human factors are more about the way we design our systems to support the realities of people in their work. Human factors is about seeing people within systems, about understanding how behaviour is shaped by the systems that they work in and the design of those systems. And that can be from the tools we use, to the way we work together, to what we pay attention to, and the physical environment. So there's a whole lot of things that go into thinking in human factors about how do we design to support human performance in terms of providing good care, but also human well-being in terms of making sure that staff feel safe and supported and are really clear about what they can do. One of the things in human factors, it's about seeing people in the whole of the system. So not just thinking about the way that we're shaped by the tools we use or our technology, but also the way that our culture, the things we pay attention to, the way that we work together, how that influences the way that we provide care. Central to the care that we've been providing over many years now is this idea about relational healthcare. If I'm interested in the realities of our team, we know each other really well, then those are the things that matter when we have a really big event. So for Whakaari, we found that the extraordinary work we did during that time was really built on the ordinary way that we worked and the relationships that we had both within the unit and across with our burns team, our infection control team. All those relationships were called on at these times of highest need. And so we see that that's an everyday thing, but it's also the basis of the exceptional work that can be done during a pandemic or during an eruption. Human factors was really central to our response to thinking about COVID. When COVID first arrived in this country, we were the unit that took a lot of the first hit of that. And before it came, we were really thinking about how do we keep our staff safe? How do we keep our patients safe? How do we design our systems to support staff to provide safe care? The nature that we saw from COVID overseas was that this really was something very unknown to us, and staff were genuinely worried about were they going to take this disease home to their families and put them at risk. Were they personally at risk from this disease? There was a lot of anxiety at that time, and it was really uncertain, and things were changing very, very rapidly. We had to design solutions that dealt with the realities that people would face. How do we design for a tired team member in the middle of the night dealing with a really unwell patient where they're worried about their own safety? For us, it was about making it as simple as it possibly could be, with things that support the right way to work. Making sure that it was really safe for our staff and our patients, making sure that we could adjust things on the fly, and making sure that we could maintain whatever we did for a long period of time. And we weren't constantly sending out a trail of emails, but just that people knew where to look for that information that was available to them. The end result has been that over the 2.5 years that we've had COVID patients, and we've had the most patients in any ICU in the country, is that we haven't had a single member of staff acquire COVID from one of our patients.